Hi everyone. Today in this video we are going to discuss about Apremilast. What is this drug Apremilast? The suffix milast indicates that this drug is a phosphodiesterase type 4 inhibitor. Phosphodiesterase type 4 is one of the important metabolic enzyme for cyclic AMP. So when this enzyme is inhibited, this drug can increase the intracellular cyclic AMP levels. We have other drugs within this category with similar suffix such as roflumilast, silomilast, ronomilast. All these are phosphodiesterase type 4 inhibitors. These drugs are particularly used in the treatment of inflammatory disease. For instance, roflumilast and silomilast can be used in the treatment of asthma as well as COPD, where they can reduce the inflammatory response. So the drugs with the suffix milast are phosphodiesterase type 4 inhibitors. But within this category, we can also observe another type of suffix. For instance, rolipram is another drug within this category with different suffix. Again, this drug is indicated for neuronal inflammatory disorders. Now today in this video, we are going to discuss this Apremilast, how this drug acts, what are the important precautions, side effects, drug interactions, doses, all these things we will discuss in this video. Now, among these drugs, Apremilast is indicated for treatment of psoriasis. Psoriasis is one of the inflammatory disorder that can affect the skin, and it can also affect the joints, resulting in the psoriatic arthritis. This Apremilast is available under the brand name Otezla for the treatment of psoriasis. So this drug can be used in the treatment of psoriatic arthritis, where the inflammation can affect the joints, and this drug can also be used in the plaque psoriasis in those patients who can be treated with either phototherapy or systemic therapy to reduce the plaque formation. In such conditions, Apremilast can be used to reduce the inflammation within the patients. Now let us see the chemical nature of this drug. So this is the structure of Apremilast. Here principal functional group is the histamide. So we can write the suffix as histamide. To this histamide, on the nitrogen, isoindole ring system is attached. So let us give the numbering to this isoindole ring. This is 1, 2, 3, 4. So it is attached by 4th position. Now we can write this as N-13-dioxo isoindole 4-yle, because oxo groups are present at 1st and 3rd position. Now to this isoindole ring system, at the 2nd position, ethyl chain is present. So we can write this as 2-ethyl. And now to this ethyl chain, at the 1st carbon, phenyl ring is present. But this phenyl is having methoxy group at the 4th position and ethoxy group at the 3rd position. So we can write this as 1-3-ethoxy 4-methoxy phenyl. And similarly, to the 2nd position of this ethyl chain, methyl sulfonyl group is present. So 2-methyl sulfonyl. That is a complete name of Apremilast. Now let us see how this drug acts. Apremilast is one of the drug which is going to inhibit release of inflammatory cytokines such as IL-1, IL-8, IL-2, IL-23, and even TNF-alpha, tumor necrosis factor alpha. So release of all these inflammatory cytokines is reduced by Apremilast. At the same time, this drug may stimulate the release of anti-inflammatory cytokines such as IL-10. In this way, Apremilast can reduce the inflammatory response as well as it can increase the anti-inflammatory mechanisms. And all these actions are mainly attributed to its action on cyclic AMP. So this drug is going to increase the intracellular cyclic AMP levels, which reduces inflammatory cascade. Within the inflammatory cells, cyclic AMP plays an important role to control the cellular activities. But this cyclic AMP is going to be metabolized by one of the enzyme phosphodiesterase type 4. By action of this enzyme, cyclic AMP can be converted into AMP. In this way, phosphodiesterase type 4 can reduce the cyclic AMP levels. Now, Apremilast is one of the drug which can inhibit this phosphodiesterase type 4 enzyme activity. By inhibition of this enzyme, the cyclic AMP levels within the cell are going to be increased. which then promotes the activity of protein kinase A. This protein kinase A plays key role in controlling cellular activities. For instance, it can inhibit the expression of NF-κB, nuclear factor kappa B, which is generally interact with the DNA. By interacting with the DNA, it can increase the expression of various cytokines such as IL-1, IL-23, TNF-alpha. All these are inflammatory cytokines. But because of action of Apremilast, the cyclic AMP levels are increased, which reduce the expression of NF-κB and other cytokines. Similarly, this protein kinase A can promote the expression of CREB, which increase the release of anti-inflammatory cytokines such as IL-10. What are the precautions? One of the important precautions of Apremilast is that this drug can produce some gastrointestinal disturbances. So this drug can produce some nausea within the patients. It can also produce some vomiting, and even it can produce diarrhea, which is more troublesome within the first week of treatment. That's why this drug should be started at very low dose, and the dose of the drug should be slowly escalated in order to reduce these gastrointestinal disturbances. Particularly, these GI disturbances are more pronounced in the elders, where they can have more risk of diarrhea and vomiting. And when this Apremilast is combined with other drugs such as diuretics, which produce volume depletion, otherwise vasodilators, which produce hypotension, these drugs, when they are combined with Apremilast, can further increase the GI disturbances. Another important precaution of this drug is that Apremilast can produce some weight loss within the patients. This is particularly observed at high dose of this drug. So when this Apremilast is given as 30 mg dose given twice daily, we can observe a significant weight loss. So if already patient is having low body weight, then this drug should be carefully used. Similarly, this drug can increase the risk of depression within the patients. So it can produce some sudden mood changes, which may lead to some suicidal initiation. So particularly in the younger patients, this drug should be carefully given as it increases the risk of suicidal initiation. Another important precaution is that Apremilast is going to be converted into its metabolites by cytochrome P450 system. So if you have the metabolic enzyme inducers such as rifampin, phenobarbital, carbamazepine, phenytoin, all these drugs can increase the activity of CYP450 enzyme, which results in the increased metabolism and decreased levels of Apremilast. So this results in the loss of activity. So with these enzyme inducers, co-administration of Apremilast is not preferred. What are the side effects? As we have seen, the important side effects of Apremilast are mainly related with gastrointestinal system. So this drug can produce some headache, nausea, diarrhea, vomiting, and upper respiratory tract infections such as nasopharyngitis, upper abdominal pain, and dyspepsia can be observed with this Apremilast. It can also reduce the appetite, resulting in some weight loss, and some back pain as well as fatigue can also be observed with this Apremilast. How it is given? This drug is available as tablets at different strengths such as 10 mg, 20 mg, and 30 mg. The recommended dose of the drug that should be maintained at 30 mg given twice daily, but it should not be started at high dose. So initially a low dose of the drug should be started, and the dose of the drug should be slowly increased such that we can reach the recommended dose. So on the first day, we can start with low dose, and dose can be increased up to 6 days. On the first day, 10 mg of the dose can be given, which is further increased to reach the 60 mg on the 6th day. So day 1, 10 mg at bedtime, but on the day 2, we can give the 20 mg in the divided doses. So 10 mg at the morning and 10 mg at the night. Similarly, on the third day, 10 mg at the morning and 20 mg at the bedtime. In this way, the dose is going to be divided, and the final dose is 60 mg given as divided doses. This slow escalation of the drug may reduce the gastrointestinal side effects within the first week of treatment. So that's about this drug Apremilast, which is a phosphodiesterase type 4 inhibitor. This drug can be indicated for inflammatory disorders such as plaque psoriasis and psoriatic arthritis. This drug can produce few of the gastrointestinal side effects such as nausea, vomiting, dyspepsia and diarrhea, which are troublesome particularly at the high dose of this drug. And this drug can also produce some depressive symptoms resulting in some suicidal initiation, so care should be taken in the younger patients. And this drug can also produce some loss of appetite resulting in weight reduction. All these are the important precautions of Apremilast. So that's for today. Hope you have enjoyed this video. If you like this video, please subscribe to our channel, share this video with your friends, post your comments in the comment box. Thank you for watching this video.